my mystery disease. Let me know if you know what it is. Butterfly rash hidden with makeup. Calcifications in the face skin. They were there for weeks. They were super hard, not an infection. Facial paralysis became frequent, chronic. Had a brain MRI, and it's not a stroke. We ruled that out. We also ruled out Crohn's. You can see here, it is chronic. This is like several years after that first snippet. This is before the facial palsy. And this is after the palsy started, also with the IgG-mediated inflammation. Just FYI, I am, in fact, IgE deficient. So, only IgG-mediated. This is IgG-mediated anaphylaxis. You would not believe how actually tiny I was before that. Look. Okay, here is a submandibular hardened mass. And here is a hepatic lesion that I was hospitalized for. The way you know that it's autoimmune is because it was painful. I felt it as pain and then went to the hospital, and that's how they found it. Lymphadenopathy, swollen lymph nodes. Here, this is a weird one. I had a bony prominence that started. It was recorded as a rib fracture, but it grew and became soft, kind of like neoplasm-like, and then it shrank with mast cell stabilizers. Okay, moving on. Raynaud's phenomenon. For some weird reason, ADHD medication improves my really low blood pressure and helps with the Raynaud's. Okay, here we have more inflammation. Tried to get, for 2 years, we tried to get a biopsy to look at small fiber neuropathy and peripheral neuropathy, but everything was too patchy and unpredictable. These are vascular changes at night, marbling, vasal inflammation at night. I don't know what that red mark is, but it comes back sometimes, and it's part of like the nighttime inflammation. Okay, this is a bruise that caused temporary veins to pop up in order to resolve it, and then they kind of went away. This is a mark that was bright orange that formed on my foot. That's when it faded. This is what it looked like 3 weeks before. More hand inflammation. It's just, this is like years later. It just keeps getting worse and worse and worse. So anytime I use my hands, they would inflame, get red, and the problem is it just kept getting worse. I can no longer do any of the things I want to do. I can't type very well, or at all, really. I can't do art. There's a lot of things I can't do. This is a rash that I keep getting that mimics autoimmune. This is me doing physical therapy for my hands specifically to improve grip, strength, and flexibility. But every time I touch anything, they inflame, and every time they inflame, it makes it worse. So this, it kind of shows you where I'm at right about now. This is the best case scenario after physical therapy, working on my hands. This is where I'm at with flexibility, trying to stretch the tissue. I don't grip well. This is showing you, systemic inflammation. You can see it's not just in the gut. We ruled out Crohn's with a biopsy. So, I mean, it's literally systemic. Again, IgG mediated. We don't know what it is. But this is showing you like how I wear different size shirts throughout the day. This is, okay, so I have motor function problems. I'm rigid. I'm weak at the same time. I have a shuffling gait. I'm very fall prone. I fall a lot. I do take an absurd amount of magnesium, which seems to help a little bit. It also seems to help with my heart function. Oh, and then I'm also experiencing a light allergy. Yay! I'm a vampire. Oh, if you know what's wrong with me, I don't know, reach out in the comments.